All right, let's take you now to this. A power outage appears to have sparked the adjournment of the National Health Insurance case in the High Court in Pretoria this afternoon. Today is the second day of the hearing in the case, which the Board of Healthcare Funders and the South African Private Practitioners Forum have brought against the Health Department. The organizations want to halt the implementation of the National Health Insurance Act, saying it is unconstitutional and does not guarantee universal access to quality healthcare. Now, COSATU has pledged solidarity with the department. Its members are picketed outside a court, calling it for the speedy implementation of the NHI Act. SABC News economics reporter Katlego Legodi joins us now live. Katlego, very good afternoon to you, and thank you so much for your time. So you've driven all the way to Johannesburg from Pretoria because of this power outage. Now, it is day 2 of this particular court case. So talk to us a little bit about what transpired yesterday, because day 1, we saw the Board of Healthcare Funders. Today, it was the turn of the South African Private Practitioners Forum. In the main, yesterday, what were some of the key nuggets that came out of court?
A very good afternoon to you, Unati, and of course to our viewers at home. This is somewhat of a landmark case when you look at where we find ourselves in terms of everybody that has been looking at the rollout of this national health insurance. Here we're talking about universal access to health care, but can universal health care exist without it trumping on the work of the medical funders and what they've managed to do over time? So that is the argument that is playing out in court right now. But you're right. Yesterday we saw the BHF being the first ones to argue here. They are the ones that took this matter to the High Court, and they were followed, of course, by the presidency and the Minister of Health, their respondents 1 and 2 in this particular matter. We see them really just pushing through to say that there are elements of illegality or element of unconstitutionality that would come through this particular act. So yesterday we saw them just arguing and pushing also for the point of jurisdiction, because the main argument coming from the presidency and the Department of Health was to say, if you are saying that this act is flawed constitutionally, why then aren't you taking this matter to the Constitutional Court instead of bringing it here to the High Court? So we saw most of today, actually in the morning, dominated by that particular argument around jurisdiction. But at the heart of where we find ourselves would be issues around the constitutionality and the processes that were followed when President Cyril Ramaphosa in May last year signed this particular NHI, the bill, into an act. And they're saying here, maintaining and telling a High Court Judge Twala that the processes, they suspect that the processes were not adequately followed here. Some of them even saying that our members were not consulted. If you are saying that there was a proper consultation process, then provide us with the records. Show us let's follow the detail in terms of what you did here that informed you signing the NHI in its current nature. So Section 33 of this NHI really at the heart of where we find ourselves now, whereby they're saying that when we see the rollout of this NHI, isn't it going to have limitations, or is it going to have limitations in terms of what this fund can cover compared to what the medical aid practitioners have been covering over the years? So there's still murky waters where that is concerned, but we see them pushing ahead to say constitutionally so as well. They're talking about Section 87, they're talking about Section 84 as well of the Constitution, saying that the president, although then he is the president and it all rests with him, there are some of those limitations in terms of the actions that he takes. So he should have consulted, also going to a point of saying that when you look at it, the powers of the president would have limitations. So the constitutional parameters, that is what they were arguing here, to say that the judge should at least ensure that there's a review of this process altogether before the president can actually, or we can start seeing the rollout of its NHI in its current nature.
Interesting. And I think that was, in effect, the argument that the national healthcare, practitioners were arguing today, including, of course, how will this all be funded? I mean, we keep hearing these discussions. Interestingly, it will be nice to see, will this record that the President, Cyril Ramaphosa, holes actually also be revealed in court. But let's talk about what happened outside of court. I mean, we know that the SACP and COSATU have been outside court very vocal in support of the immediate implementation of the NHI Act. We know, of course, even the health department has said that that will take some time. But in the main, what are they saying?
So we saw COSATU actually even calling on the greater public to join them outside the High Court. Yesterday, they were there on the ground demonstrating with the SACP, their alliance partners, but also saying that this is not an SACP or a COSATU demonstration or a picket. It's a picket that involves the greater public. Taking us back also in history to say that really when you look at it, this NHI is coming through to balance matters where access to healthcare and adequate healthcare is concerned, but also talking about how it's going to address issues of infrastructure as well, where the public facilities are concerned, saying that it will ensure that, you know, more or less, even taking it to say that when you look at it, the marginalized have always been the black people, and that they have not really enjoyed some of these accesses to privileges that would come with healthcare, and they were looking to the NHI for it to come through and level the playing field. So they were outside demonstrating in high spirits. We saw them yesterday. Today as well, I got a chance to speak to them. Zanele Sabela, the spokesperson of COSATU, just basically saying that it's a do or die, because we can't, you know, in any way allow for the coming 31 years to be the same as the previous 31 years. So they're looking at supporting government, saying that really be steadfast, President. You were exercising your constitutional duties to sign this into law, but they also argue to say that really it's misplaced. The argument being brought to the High Court is misplaced. So we are still there. We're still arguing and seeing whether the High Court would have jurisdiction to entertain this matter in its entirety, or he's going to Judge Twala dismiss it and say that it's a matter we don't have jurisdiction, it must move to the High Court. But it's been slow, because you can understand that today we're supposed to have a full day of this sit-in that would be in person, but the power outage there led us to us just adjourning early. But as we speak right now, the court processes are continuing online, so it has moved from physical to virtual, because they're saying it's a desperate situation. They have to ensure that some of these issues are ironed out before we can start seeing the implementation and the rollout of the NHI. We still have to have a CEO. We need the board that will have to oversee this particular process, and we need to see how then we're going to see all of these hospitals and facilities getting the best out of this process.
Absolutely. So much to consider in this particular court case, also so much at stake. Katlego, thank you so much for that. Katlego Legodi there, just giving us a sense of what transpired in court. Of course, this is all about the National Health Insurance case in the High Court in Pretoria. It is now moved from physical to online, so he'll be monitoring developments there for us.